worked for years, but small jobs. So when my husband passed, I draw his Social Security. I am now 72 and was told I should have called when I was 70. Have I missed my drawing retirement? Absolutely not. So what happened is you collected survivor benefits when he passed, and that means you didn't touch your benefits on your own record. So your benefits continued to increase, and they will continue to increase up until 70 based on delaying. At 70, there is no more delay after 70. So yeah, if you should have called at 70, then they're saying, yeah, you're 70, you lost 2 years of benefits, but they can give you 6 months of retroactivity. So they can at least 6 months. And then I would always ask for more and say, hey, I didn't know about it. And, I called you all like a year ago, and why didn't you tell me at that time? And try as best as you can to get as much back pay as possible. But at the very, very, very least, they can give you 6 months of back pay. So call immediately, if not sooner. Call immediately because you don't want to lose any more money. And so what you're basically doing is switching from your benefits, from survivor benefits to benefits on your own record. So, Sarah, run to the phone. My boyfriend only has Medicare A and B. 2 weeks ago, he had an accident and had to go to the emergency. Now, is it possible to still add a supplement plan, or is it too late? I would do it. Yeah, if you only have A and B, then unfortunately, that's going to be tough because remember, original Medicare Part A and Part B, pretty awesome. They're not perfect. But the big thing is Part B is a 20% copay. And so the hospitals, there's deductibles and stuff that you have to pay. And then Part B, and you're like, oh, okay, well, that's great. Most of my stuff was done, most of the stuff was, it was done in the hospital. So don't have to pay that 20%. But remember, that's not how it works. If you go into the hospital and you stay, overnight, 3 nights, whatever the case may be, that is covered under the hospital. But then a doctor comes in and does stuff, surgery or whatever the case may be. That's the doctor type stuff is covered by Part B. So yes, you're in a hospital. Let's have you have knee surgery. You're in the hospital and you think that, oh, I'm in the hospital, so the 20% doesn't count. No, the hospital charges, the overnight and all that kind of stuff in the hospital, that's covered under Part A, but the doctor actually doing the knee surgery, that's covered under Part B, and you have that 20% co-insurance they have to pay, and then the deductible and all the rest of it. So I would definitely, because if he's had some type of accident, I'd reach out to Chapter immediately and get signed up for whatever and hope for the best. Probably they're health insurance companies, they're in it for $1. So if they can avoid paying stuff that has already happened, they will do it. But if he has an issue, then obviously he's going to have other things going in the future. So get started, get something immediately. So who watches over the people that work at the Social Security, and is it possible for them to steal? Yeah, absolutely. I've fired several people for not doing the proper things, and it's usually people accessing records. One of the people I fired was alimony or child support. I think it was alimony. And wanted to see what her ex-husband was receiving to see if she can get some more alimony out of that person. And so she looked at the Social Security record, and Social Security tracks every time you touch the keyboard at Social Security. So it immediately comes up as a red flag. And so gave her the big chicken dinner, bad conduct discharge, as we used to say in the Marine Corps. Yep. But during the government shutdown, guess what? The Inspector Generals, all the stuff like that, yeah, they don't do. So yeah, it's crazy. Social Security suggested, and what's even worse is the Doge people in there. I don't think they get reviewed because they're above the law, kind of. That one Doge person that put everybody's information on an unsecured cloud. Yeah, he's still there. So for regular Social Security employees, if a regular Social Security employee had done that, yeah, they would have been out. But Doge is above the law, I guess. So Social Security suggested that I divide all household expenses in half. Utilities, food, and half would come out of their Social Security. The other half from my husband and my dollars. Obviously, I use their money for clothing. Okay, so yeah, the only time they would do something like that is if you're receiving SSI, Supplemental Security Income, the welfare-based program. Yeah, any other money you're receiving from, Social Security retirement or Social Security disability insurance, regular or spouse benefits, no relation to anything whatsoever. But yeah, if it's SSI type stuff, yeah, then if you got two people in a household, then yeah, that's how it works out. Well, there's an exception. If you have a stepchild, there's a half support requirement for that, but I don't think that's what you're talking about. So, Rose, I wrote your address down and I'll be sending you something wow. So, you guys are just awesome. Let's see. They told me my birthday, April 1, I don't qualify because of pre-existing condition. Oh, they told me birthday, April, I don't qualify because of pre-existing condition. Don't qualify. There is no, well, the only pre-existing condition that a health insurance company can deny you nowadays is a Medicare supplement plan. The Affordable Care Act, the Marketplace, Obamacare, whatever you want to call it, that ended the whole pre-existing condition. Remember before the Affordable Care Act, we used to hear in the news all the time, a little 12-year-old girl that has to go in and get surgery and stuff like that. And she had it's the stupid name, pre-existing condition. It's called your medical history. They used to be denied health insurance all the time because they were sick, and so they needed to get health insurance, and health insurance companies could deny that. That ended with the Affordable Care Act, so that's a beautiful thing. And Medicare Advantage, they can't deny you. They can't deny you for a pre-existing condition. Medicare Part A, Part B, they can't deny you for a pre-existing condition. For a Medicare supplement plan, a Plan N or a G, they can't deny you if you're in if you're in your initial enrollment period. So you just turned 65, you're around that time. If you've lost health insurance from work, if you're in that special enrollment period, they can't deny you. But anything else outside of those particular areas, yeah, they can deny you for a Medicare supplement. Some states they can't, but it sounds like you're in a state that they can deny you, and that is a state issue. So we need to, why does pre-existing conditions not exist in any other health insurance, but it still does in some states for Medicare supplement? It makes no sense whatsoever. So it's because we have just an unbelievably crazy system, and it's getting far, far worse. Millions of more people are going to be cut off of health insurance, the Affordable Care Act, because their premiums are going up significantly. Medicaid is being cut by $1 trillion, and that's what the government shutdown is all about. It's illegal to give health insurance to people that are not in this country legally, period, end of story. If there's an emergency, just, the alternative is, okay, so if if you're in a terrible car accident and you go to an emergency room, or you have a heart attack, you go to emergency room, do we want the doctors to say, oh, okay, yeah, you're bleeding out, but I don't think you're an American. You look kind of Canadianish or whatever. Let's see your papers. Before I stop the bleeding, I want to make sure you're, in this country legally. And so, yeah, is that what we will want? No. So the money doesn't go to undocumented immigrants. It goes to the hospitals, because the hospitals take that hit. It's uncompensated care, as they call it. So if someone goes into anybody, even American citizen, most of the times American citizens, they go into a hospital and they get fixed, and they don't have health insurance. And so the hospitals get stuck with that. The doctors get stuck with that, and they just raise the prices. But if the government can go in there and compensate the hospital for those lost income based on Medicaid. So yeah, that's what it's all about. So I feel so bad for seniors who are helpless and without assistance. I agree, and that's what we're going to be. That's what we're working on right now, is to help as much as we possibly can. Bonnie, you're such a wonderful person. Yes, and Mama, I know you are as well. We've got so many awesome people in this in our thing. So, um, I called chapter. They said stay where I am. Not any real different choices in my area. Perfect. Yep. That happens quite a lot. So at least you check. So you did the right thing. So you got peace of mind that you're in the best plan. So you don't have to do anything. Your current plan that chapter checked out for you and said it's the best plan in your area, it'll just automatically re-enroll. So you don't do anything, and next year you've got essentially the same plan you have this year. So, well, I'm sure they changed around a little bit of details under the hood, but it sounds like it's still the best one in your particular area. So, yep, you did the right thing. Perfect. Yeah, that chapter does that a lot. And it's like, oh yeah, yep, still the same. You're in the best one. You're good. We'll talk to you next year. So, Rose, take a deep breath. The cavalry is on the way. I need to where to send a check. Oh wow, awesome. Let's see. Too late. They already put the yeah. The lady at Charter did not know what COLA. Yeah, nobody knows what you mean chapter. Yeah, nobody knows what the COLA is going to be for next year. So they won't announce that for a little bit. So normally within the next week, but yeah, it's all we don't know now. I have friends and family in Canada and the UK who are in awe at how much we as a people are spiraling. Yeah. But we've been in worse situations in this country, and we've always, Winston Churchill, Americans always do the right thing after they've exhausted all other possibilities. All right, everybody's helping out. Let's see here. Turn 65, 12/7/25. I applied for Social Security retirement benefits to begin 1/26. Won't actually retire until 5/26 for 4 months. What happens to that withheld dollars? Will I eventually be refunded? Okay, so you turn 65 and you're going to continue working, retire. So you're making over the full. So you're going to begin January, but the first 4 or 5 months of benefits are going to be withheld because you're making over 23,400. Does that sound correct? What you're saying there? If that is the fact, then what happens is, your benefits start in May. So, because the first 4 months are being withheld, so that means they're withholding that check completely, and they're going to release the check in April or May. So what happens is once you reach your full retirement age, they take that into consideration. So let's say next year you work and they withhold the first 4 or 5 months. So they add those together. So let's say they withhold 5 months this year and then 5 months next year for a total of 10 months. So let's say you're taking your benefits 2 years early. So your benefits are reduced by 24 months because you're taking it 2 years early. Once you reach your full retirement age, the computer system automatically goes in there. It's called ARF, adjusted reduction factor. And the computer system automatically goes in there and says, hey, Jay is reduced by 24 months. But he didn't get 10 months of benefits because we withheld those 10 months. So what they do is they add those 10 months in there, and then going forward, you don't get reduced by 24 months, you get reduced by 14 months. So that's automatic. And so they'll do that once you hit your full retirement age, 100% automatic. So, all right, let's get into some video questions. I've got quite a few here because we spent some time talking to Ari yesterday, and I wasn't able to get to the video question. So let's see what we got.
Hi, Dr. Ed. I'm having a problem. I have a judge's order. It's been almost 2 years since my ALJ hearing, and I got a favorable decision. The judge signed my order November 1st, 2023, sent it to the Maryland Home Office for them to process and calculate my refund. Unfortunately, the Maryland Home Office kicked it back to my local New Haven, Connecticut office, which the workers in the New Haven office are totally useless. This has been going on since 2021. They owe me almost
Wow.
$35,000. I have all my 1099 tax forms from 21, 22, 23, showing that they kept all of what they thought they overpaid me and then some, and they're still taking out the minimum $20 a month.
Okay. All right. So, wow, that is completely unsatisfactory. If the administrative law judge said, hey, pay this lady X amount of money, and they've been waiting that long, something definitely has fallen through the cracks. One of the problems is Elon Musk and Doge, recently, 8 months ago, got rid of a lot of the processing centers, the people that would normally work on that. But that your problem started before that, which there were problems even before that. It's been, Social Security has had problems for a while, as that's exactly what politicians want to be happening, is bad customer service. So in your particular case, I would normally tell you to reach out to your politician, and on your politician's website, and all politicians' website, the one that goes to Washington, D.C., you write, there's a little button that says, I need help with a federal agency, or you call them up. So call up one of your 2 senators, your House representatives, and you say, hey, here's the issue. And they will do what's called a congressional. But unfortunately, during a shutdown, it's even more difficult because I just read all of the workloads that they work during a shutdown, which has changed quite a bit from previous shutdowns. And it doesn't look like they work that. But I would get the process started. Reach out to your congressional representative and say, here's the situation, and they will expedite it. Yeah, even if it is shut down, I would definitely push it. Okay. So I mentioned SSA.
Hi, I'm from San Antonio, Texas. And I might, well, his daughter asked me if I'm already getting survivor's benefits. I have not applied for benefits. I'm 71 years old. I've been a widow like forever. I was common law married to him like forever too. So I just want to know, am I entitled for this? Yes or no?
Okay. Yeah. Common law marriage. Some states do accept common law marriages. Some states currently don't, but they did before. So the best way to do it is just call Social Security. Social Security has to abide by local state law when it comes to marriage and divorce. So wherever you were married to him, if it's Texas, wherever, maybe you moved around. So I would call Social Security, and Social Security will look. You just tell them, I was a common law for 10 years, and we lived in this particular state, and they will look in the POMS and the policy manual that they have. It lists all of the states and all of the times and what's the documentation that you need to prove common law. So you had to be what's called kind of holding out as a husband and wife, on the same lease and stuff like that. So, but don't worry about it. Call Social Security, set up an appointment to file for surviving spouse benefits or whatever, and they will figure out exactly what you need. So get that process started.
To my children, 7 years old, I was filing early retirement 62. I don't know how can I do that to get my benefits, my children.
Easy. You just go ahead and file for benefits. And then as part of the retirement process, they will ask you, do you have any children under the age of 18 or became disabled before the age of 22? You can tell I've asked that question about 1 million times. And you say, yes, I do have a child under the age of 18 or that became disabled before the age of 22. And they said, okay, what's that person's name? What's the child's name? What's the date of birth? Do you have the Social Security number? And then they'll give benefits on your record, basically 50% of your full benefit amount. And then there's a family max in there. So if you have more than one child, the family max might kick in. There's a maximum amount that could be paid out on a record. And then they will also take an application. So if you're doing this, if it's one child, then you're going to have 3 applications. You're going to have an application for your retirement benefits. You're going to have an application for, it's called child, auxiliary child claim. And then you're also going to have an application to be the representative payee for that child. So you or the mother, whoever can be the representative payee, that's ultimately responsible to make sure those benefits go for that child's welfare. And the child will receive benefits up until the age of 18 or until they graduate high school, or 19 and 2 months. And if you have a wife that is taking care of that child and the child is under 16, then there's what's called auxiliary child and care benefits that the mother, the other spouse, the other parent can receive benefits as well. But they're limited the amount of money they can make in work and stuff like that. So definitely ask about that. Says, yes, I have child under the age of 18. And what's this child and care thing? You know, am I eligible for that? Is the spouse eligible for that? Definitely check that one out as well.
He's married to for over 20 years, and both of them has passed away. Can I still draw off either spouse? Thank you. God bless you.
Short and sweet. I like it. Okay, yeah. If you're married to multiple people and you were married the required time frame, if it's a divorce type situation, you were married at least 10 years. If it was if that person passed away while you were married to them, at least 9 months. There's a couple of exceptions in there. There's everything Social Security. There's exceptions. But yeah, call Social Security. Find out if for survivor benefits, you have to be at least 60 years old. For regular spouse benefits, 62 years old. But yeah, call Social Security and say, hey, here's the Social Security number on my previous spouses, or here's their names and date of birth, or how old they are, where they were born, as much as information you know. And the Social Security person can find those 2 records, and they will look at it and they will determine whether you're eligible for benefits on either one of those records. So they will always go for the higher benefit. So whichever one gets you the most money, that's what they'll get you for. That's what they'll sign you up for.